what's up, beautiful people? This is your tooth doctor, Maureen Mora. Welcome back again to my YouTube channel. All we do here is talk matters oral health, and it is simply because I believe everybody is entitled to good oral health status. And guys, in today's video, I want to talk about a condition that affects children, some children, and most parents don't think it is more of an issue until the side effects are felt later on as they continue with their parenting, and that is tongue ties. Tongue ties, usually they are self-diagnosable because the symptoms are clear for both the parent and the oral practitioner to recognize them as well. So basically, your tongue is supposed to reach almost every part of your mouth. That full range of movements lets you make different sounds like you speak, as you speak, that is. Also, to keep your mouth clean. Most people will be wondering what happens when you have tongue tie. It's basically a condition that restricts the movement of the tongue to do its job well, and it's usually present at birth. Symptom-wise, it's self-diagnosable, and the signs to look out for here, they include difficulty in sticking out the tongue past the lower front teeth, difficult to lift the tongue to the top or to the upper teeth. You will find that your child, you cannot be able to move the tongue from side to side. The tongue has a V shape or a heart shape at its tip when sticking the tongue out. And for the newborns, the signs to watch out for include when you find the baby doesn't want to latch well, chewing more than sucking, the child is fussy during feeding times, the child makes some clicking noise when feeding, the child is also always hungry, baby may not gain weight as expected. And this is just a clarification for you parents. Tongue tie are not the only thing that can cause the child not to breastfeed well. So if you find that your child is not breastfeeding well, and you've checked on the above signs and your child doesn't have tongue tie or has tongue tie, it is high time that you get to contact your doctor to address any other underlying issue that could be making the child not to breastfeed well. Wondering whether tongue tie goes away on its own? In most circumstances, as the babies grow older, the problem changes, but tongue tie itself does not go away. So even in situations of minor tongue tie, it is better to have them addressed. Yes, tongue tie can affect the mother as well, because now if the mother is breastfeeding and the child is not sucking well, it can cause some pain on the nipples during or after breastfeeding. It can cause some soreness or cracked nipples. It can cause something we call mastitis, which is the inflammation of the breast, or it can reduce the milk supply as well. Tongue tie can be done. There's some treatment measures that can be done if your child is having tongue tie. Number one we have is frenotomy. This is a basic procedure done at your doctor's office. Sometimes you even don't need to be numb. After the procedure, your baby can breastfeed right away. And them feeding right away is very important because breast milk is can help to soothe and help the wound to heal as well. And another thing we have is frenuloplasty. This one is done when the frenulum is too thick for a quick snip, like in the case of frenotomy. And this procedure is usually done under local anesthesia. Yeah, there could be some risk factors associated with the treatment of tongue tie, especially in the cases of frenuloplasty. And some of the risks to watch out for, they include infection if the wound will not be cleaned and maintained well. We will also have damage to the tongue or even to the salivary glands, which is around that area, if the procedure is not done by a qualified person. We can also have some rare cases, excessive bleeding. Yeah, getting a tongue tie dealt with is very important because it has some benefits like preventing the child from getting some dental problems. It can also help the child to eat and even breastfeed well. It also controls in speech interference. Remember, if the tongue's movement is not appropriate, then there are some sounds you cannot be able to make. Yes, that's it in regards to tongue tie. I hope you've gotten to learn something with your tooth doctor. Let us get to meet in my next video. Bye bye.